Hi, welcome back. This is Dr. Katina, and this tutorial is about the second Intervention Componentry tab. And as a reminder, my study is a randomized clinical trial. So the first question is about how long the intervention was provided. So if we scroll down to methods, they do list right here that because of the logistics of when the decision to have surgery was decided and then when the surgery actually occurred was usually about 2 to 3 weeks, that was the time frame that they were using to provide their intervention. So for that answer, although they did say above in the lay abstract that there was a mean of 3 weeks, but I feel comfortable saying that this was 2 to 3 weeks. Again, if your answer is not here, you can use other and it will provide you a different option to write in your own length. Were they able to keep the intervention this length, or did people drop out, or was there other reasons they weren't able to? I feel that they were able, that they demonstrated that they were able to. Again, they do say a mean and they say a median of 8. But the max they could get was 9, and the minimum they could get was 6 in terms of sessions. If they wanted it 3 times a week, as it states right here, for at a max 3 weeks. So I'm going to say yes, they were able to keep it at that length. And then was it different than proposed? I'm going to say no. For the frequency of the intervention, so how often did they come and cycle? I'm going to follow what they said right here, which is it was 1 to 3 patients at a time for 3 times a week. And that option is here. Again, if your option is not listed here, you can choose other, and it will provide a place for you to write in your own option. What was the total number of sessions? In the results, ideally, they want 3 times a week for 2 to 3 weeks. So you could say a range 6 to 8. But they report a median of 8 sessions. Right here was able to occur. So I actually am going to write in here a median of 8. So the next question is regarding what was the dose or dosage of the intervention. So they performed, that's in the methods section. So they performed their intervention based on minutes and seconds. And then they had other components that determined the intensity of that amount of time of biking. So in terms of dose, I'm going to say that it was in minutes and seconds. It was a total of 30 minutes, which it says right here. But then they had sprints in 15 seconds. They had minutes of warm up and cool down for a total of about 20 minutes. But they have other components that we're going to discuss in the next question in terms of how they determine the intensity during that time. So what variables were used to determine the intensity? So as we just were talking about, what I see right here is that they primarily use the modified Borg scale to look at dyspnea and leg fatigue. They looked at heart rate. I know they looked at percent oxygen because it's listed down below. And here they say heart rate, oxygen, dyspnea, leg fatigue, sensation, on the Borg scale. So I would say they used all of those to determine intensity. And I chose more than one, and it will list them as you see here. I apologize for the hover defining intensity. It's covering that because I have the screen squished, so we can look at this side. So list any comments or concerns about the dose, and then you hit the add. So in terms of the intervention dose, in reading this, it's very specified per patient. So it's very patient specific. It says right here, they were unable to complete the sessions at a certain percent power. They were able to lower it. They used a range of around 5 on the Borg scale. So it was very patient specific. That might have helped adherence. I'm not sure, but it was very patient specific. But also, they measure as their functional outcome measure for us, was a 6-minute walk test. However, they did not do walking. So they measured the 6-minute walk test, however, did not perform walking exercise. So in terms of a specificity rule of exercise and training, that's just something I could note. So in terms of tailoring, what I'm saying here is, did they have a protocol that they went by and how they determined what they provided in the intervention and how much, how intense, and how did they tailor the intervention for their patients? So it was adjusted according to a protocol. They had the HIT protocol, the high intensity interval training protocol. So they did use a protocol that they had studied before. So that's one. Also, as we just said, they changed the intensity and adjusted the intensity per patient based on whether or not they reported dyspnea. They used the Borg scale. They used oxygen levels. They used fatigue, perceived exertion, because they reported their level of exhaustion. So that's what I would choose from that list. Okay. And if there were other methods of how it was adjusted, I would say, or I would include, that they were verbally encouraged. Well, actually, I wouldn't put that in this portion. There's another section that would go well in. So was adherence assessed? Yes, it was. If you look in the results, adherence for the training sessions was assessed. And under what guidance was it? So up here you can see very specifically that it was performed under the expertise of a respiratory physiotherapist. So let's look and see if it's on the list. It is. If yours isn't, again, click other, and another will appear here for you to write in. So, but ours is listed, respiratory therapist. So in terms of a group, not a group, they say right here that it was 1 to 3 patients at a time. That does fit with a group less than 3. I'm going to say other and say I'm going to specify 1 to 3 patients at a time. That's fairly specific. In terms of the setting, it is not clear where this was performed. They never specify where exactly this was performed. It sounds like it was in the research setting. However, it's not clear. So I have to say other here. And here I could say unspecified. Right? There's nothing to put here. So for mine, it's time until surgery, because they didn't talk about neoadjuvant chemo, and this isn't until radiation. So if yours is only one of these, and again, it was not 2 to 4, so I had to do other. It was 2 to 3 weeks prior to surgery. And then if these don't apply to you, as they don't apply to me, I would leave them blank. And that finishes that section. I will see you at the next tutorial, which is statistics. Thank you.